Hi, my name is Fred Rotnick, and I am the Director of Community Medicine at St. Louis University and also the Program Director of the Addiction Medicine Fellowship. Today, I'd like to speak with you a bit about alcohol use and self-assessment for medical trainees. The United States has a complicated relationship with alcohol. What we see on this slide is the prevalence of drinking among the US population greater than 18. And on the right, we see the prevalence of binge drinking among the same population. Notice these numbers where we talk about frequency of alcohol use, and all of this information is self-reported. It's from the National Survey on Drug Use and Health, a self-reported survey which is put out by the National Institute of Health every year. We'll compare this now to college-age students, whether they are enrolled in college or not enrolled in college. The prevalence of drinking among college students, 52.5% compared to 44% of people of the same age. And then also with binge drinking, students enrolled in college, 18 to 22, report a higher prevalence of binge drinking than folks who are not enrolled in college. Here's a link to this information if you'd like to look at it on your own. So we've looked at the US population. Now take a look at US college students. We know there's consequences for college students if they have an alcohol use problem, whether it's risky use or long-time use or chronic use. There can be an academic fallout with missed classes, poor school performance, withdrawal from classes, courses, and even dropping out. Health consequences, we're used to seeing these as healthcare providers, but also we see a much higher use of, we see much higher sleep issues and problems with depression associated with alcohol use disorder and risky use. And of course, acute risks of risky alcohol use include impaired driving, unsafe sexual behaviors, fights, sexual assault, suicide attempts, and lots of unintentional problems, up to and including death. Now let's compare that to a survey that was done on burnout and alcohol use among US medical students. Pretty broad survey, 12,500 students surveyed. Response rate was good at 35%. Of these students who did respond, 32.4% met diagnostic criteria for alcohol abuse or dependence, what we now term alcohol use disorder. There are also some interesting correlations among students who met these criteria, and those were students who were burned out, depressed, or reported low mental or emotional quality of life. There was also a strong association among alcohol use disorder and emotional exhaustion and depersonalization. And then also there were other associations, including having some debt or having a lot of debt, being unmarried, and being younger among your cohort. Then if we take a look at broadening this pool to American physicians in general, there's been some studies to show again that there are many physicians who are dealing with some type of alcohol use disorder. Again, a very large survey, about 26%, 27% of physicians completed this survey. And you may find it striking that 13% of male physicians and 21% of female physicians met diagnostic criteria for alcohol use disorder. In this survey, the researchers found out that abuse of prescription drugs and illicit drugs was rare. So misuse was rare with prescription and illicit drugs, but the legal stuff, alcohol, was fairly high in terms of prevalence. Again, factors associated with alcohol use or dependence, what we now call alcohol use disorder, were associated with hours worked, male gender, being married or partnered, having children, and being in any other specialty than internal medicine. Something seems to be protective there. The specialty choice was strongly associated with alcohol abuse or dependence. And then also alcohol use or dependence was associated with burnout, depression, suicidal ideation, lower quality of life, lower career satisfaction, and recent medical errors. The references here are included at the end of this presentation. What's important about this slide is that too often in medicine, we're looking at the long-term effects of alcohol use or the long-term effect of any chronic condition. However, what we see associated here is that physicians have poor quality of life on a day-to-day basis due to misuse of alcohol. And that's what this last bullet point really drives home. So let's take a look at the real elephant in the room when it comes to alcohol use, and that is problematic drinking. Sometimes we can call that risky use, but essentially, when is drinking causing problems? Healthcare professionals are at increased risk. We see that already with physicians, but it spreads across all professions in healthcare. And part of that is the way we use alcohol in the US. We drink to celebrate, we drink when things go well, we drink when things go poorly. We also drink socially and to feel more social. We're still liable to succumb to peer pressure, even as adults. We use alcohol to deal with unpleasant emotions and stressful situations. And sometimes we just enjoy drinking to get drunk or feeling intoxicated. So long-term effects, we're comfortable with knowing what those are because we are studying or have studied the long-term effect of alcohol on the body and on relationships. However, let's look at the short-term effects of problematic drinking. Oftentimes, this is the first red flag that somebody might be engaging in problematic drinking. When concerns are brought up from family and friends, when we see our personal and professional relationships strained, when we see our performance at work compromised because we're missing days, or we're cutting out early, or we're drinking during breaks, and of course, financial problems. Drinks at a professional venue, at a bar, at a restaurant are not cheap. Alcohol is not cheap for the most part. And we find out that we're spending a lot of money on our habit rather than on things that are important to us. Again, these are all quality of life issues that are important to think about when we're looking at our alcohol use. But it is possible to assess our own drinking behaviors. You can do this if you want. You can change your drinking behaviors if you want to. Not everybody needs to, but this is a time of life for medical trainees in particular, where there's a lot of stress and we find ways to cope with stress, with uncomfortable emotions, and with the demands we have at job and at home. There's a lot of tools on the SLU Graduate Medical Education website under the Wellness Community banner that can provide some ways forward to assess drinking behaviors and to change those behaviors. Those include mutual support groups like AA and Smart Recovery, counseling and therapy that we have access to as trainees here at SLU. There's medications that can help with cravings and to keep us off of problematic patterns of use of alcohol. And there's also new technology in the realm of digital therapeutics, which we'll talk about in a minute. So these resources are available at St. Louis U. the SLU School of Medicine Wellness Resources. Google that, it'll take you there. We have a wellness community at St. Louis University whose goal is to optimize the wellness, health, and thriving of all trainees and attendings and staff at St. Louis University. And also in family medicine, we are doing work around treatment of alcohol use disorder and other substance use disorders. What I'd like to turn to now is a new resource that we have at St. Louis U called Vorvita. This is a digital therapeutic created by the company Orexo. I've been working with this company, and we have a team at St. Louis U who's been reviewing the process of how we can implement Vorvita as a digital therapeutic for our trainees at St. Louis University. Dr. Kelly Everard and I have been working with the IT folks at Orexo who developed Vorvita, and we now have the opportunity to offer Vorvita to any medical student, resident, or fellow at St. Louis University for a free of charge 6-month trial. This is what the typical course of Vorvita is in the community. And what we're doing at St. Louis U is working with the company to provide some quality indicators on people who use the digital therapeutic to be able to describe their experience using it. A little bit more about Vorvita. It includes applications of cognitive behavioral therapy and other techniques to help users of Vorvita to identify triggers, change behaviors, and develop healthier responses to urges for alcohol use. Again, it's a tool to develop self-awareness and to assess someone's alcohol use. It's not necessarily indicative of anybody having a serious drinking problem, but it's a chance for people to take a look at their own patterns and behaviors. And if they'd like to cut down their drinking or abstain from drinking totally, um, there's been great responses in use of Vorvita to see positive changes in drinking less alcohol in as little as 3 months of using the device. To see more about Vorvita and what it looks like, take a look at Vorvita's website. Just Google it, it'll pop right up. If you are interested in accessing Vorvita and to have a free trial, you can do so on your own by calling 1-833-VORVITA, and you'll talk to one of their customer service experts. They will ask you for your SLU email. This is the way we're able to provide this free of charge. What level of training that you're in, preclinical medical student, clinical medical student, intern, resident, or fellow. And you can give them this SLU specific code. They'll ask you for it, HOWBHSEZ. As part of this trial, we ask you to complete a pre and post survey on the ease and attractiveness of use of the product. Did the product work? Did it help you? Orexo will de-identify all the survey data so that they can give that back to us in an aggregate form so that we can see, are there things that we can improve in the services we have to support our trainees at St. Louis U. Again, will be de-identified and aggregated. Here are the references of the studies that I've mentioned earlier today. And at this point, I would like you to consider your alcohol use. If you're concerned about what you're using, if you're concerned about the amount that you're using, consider enrolling in Vorvita. There's no obligation to complete the digital therapeutic course, but it is an opportunity to take a look at ways to reflect on your drinking and see if during this time in your professional life, it's worthwhile setting some goals, so that you can be the healthiest, most effective, best adjusted trainee in medicine. Thank you very much.